The PA projection of the wrist with ulnar deviation is performed with the patient seated at the end of the table. A lead shield should be placed on the patient's lap for radiation protection. The height of the table should be adjusted so the patient's arm and forearm rests easily on the table. The patient's protonated wrist is centered on an 8 by 10 inch image receptor. The wrist is put in extreme ulnar deviation. The central ray is directed either perpendicular to the scaphoid or, for clear delineation, a CR angulation of 10 to 15 degrees proximally may be used. Collimation improves radiographic contrast. When making the exposure, the patient should remain very still, but suspended respiration is unnecessary. The PA wrist radiograph should demonstrate the scaphoid without superimposition, distal radius and ulna, carpals, and proximal half of the metacarpals. Appropriate contrast and density will demonstrate both soft tissue and trabecular of the bone. The PA axial or scaphoid Stecher method has the patient's protonated wrist still centered to the 8 by 10 image receptor, which is placed with the finger end on a 20-degree support. The central ray is directed perpendicular to the scaphoid. Collimation improves radiographic contrast. When making the exposure, the patient should remain very still, but respiration is unnecessary.